So hello, everyone. I'm Dr. Andrea Nerlich, she, her pronouns. I'm the director of the Rehabilitation Counseling Program for those of you who may need it. I am a wonderfully middle-aged woman wearing glasses with curly brown hair, a sweater, and a dress with leaves on it, blue dress. And I'm sitting in my office surrounded by a lot of pictures, and you can kind of maybe I spy a couple of Wonder Womans behind me. So just to give you that in the way of a visual description. So I'm glad you joined us today. We're not going to make this overly long, but I wanted to provide an overview to what the field of rehabilitation counseling is, how it might be different from maybe some other things that you're interested in, as well as specifically what it's like at Hofstra. Okay, so welcome to Explore a Career in Rehabilitation Counseling. So I get asked this question a lot, what is rehabilitation counseling? Just yesterday, I had a professor at Hofstra, who's an undergrad professor, say, hey, can you give me the elevator speech? What is rehabilitation counseling? And I've kind of become good at that because despite being a specialty of counseling for over 100 years, we have not necessarily maybe had the same name recognition that maybe some other specialties have. But we work with people with disabilities. And so my elevator speech typically is we work with people with all disabilities and focusing on vocational, educational adjustment and independent living goals. Okay, so we subscribe to the socio-political model or the biopsychosocial model. So we're not just thinking medical model and what the person's diagnosis is or what their disability is. Yes, that's a part of it and it's a very important part. But it's more important to know how that person experiences their disability, as well as what's the interaction with that person in their environments. Okay, so we actually, while we do a lot of counseling with folks and interventions and case coordination, we also do a lot of advocacy and we do a lot within the community to try to change the community and society and everything so that it's better for folks with disabilities. So you can see here, we assist folks with disabilities in adapting to their environments, assisting the environments to be accommodating to them as they're coming in, and then work for full participation. I think that despite a lot of gains we've made in terms of civil rights for folks with disabilities and trying to work toward equal rights, there's still unemployment for folks with disabilities. There's still some inequities. So we always have work to do, and that's a good thing. We are a CACREP-ACCREDITED program. We are unique in the fact that we work with everyone, with disability, and we'll see that. Sometimes folks ask, how is this different from social work? Social work tends to be more of a generalist degree where you're focusing on getting folks into systems and hooked into things and, connected with the right folks. We do a little piece of that. Things like mental health counseling as well as addictions counseling, again, are a specialty working with disability, but those are specific to just DSM-5 diagnoses typically. What's going to be good for you is that we do that too, but we also have a much broader base of other disabilities that we work with. And we're not necessarily like occupational therapy or physical therapy or speech language pathology, because those are, considered more allied health professions and focus on specific modalities or, restoring different functions or augmenting functions for folks. But we do work a lot with them as part of our interdisciplinary teams. So when I say disability and what are the populations, well, it's kind of everyone. So you can see that there's a number of types of disabilities. And if I had you in class right now and said, tell me what a disability is, we'd probably rattle off some of the themes and names and terms that you see here, okay? And why I say we kind of have a little bit of a leg up to some of the more specialized say mental health or addictions is that oftentimes when someone is walking through your door to get services, they don't just have a mental health condition. They don't just have a substance use condition. They may have physical disabilities, learning disabilities, a trauma history that has led to, chronic illness and health complications. And you as a counselor are not going to then have to say, oh, well, let me refer you to someone for that. You can do the counseling and understand fully the experience that the person has. And, we are always a growing field. And like I said, we've been here for 100 years. 20% of the population at any point in time is considered to have a disability. And I always say it's kind of the only equal opportunity minority group, because if you live long enough, or at some point within your life, you're likely to experience a disabling condition, either temporarily or permanently. So we do see that there's a lot of need within our field. We also see things like COVID-19 pandemic and how that has created disabling experiences for folks, health inequities that we see that either cause or exacerbate disabilities. Climate change actually is having causes in terms of disability, violence and trauma experience. So we see that there's higher rates of disability, and we're going to need a lot more folks holistically trained, especially if we think about the pandemic with the growing need for mental health and substance use, but then coupling that with some of the disabling experiences that are a result of COVID-19. So we have to work more inclusively with folks, but then work with the communities to be more inclusive of them. So rehab is very value focused, and what's important is we always keep the client in the middle. Okay, it's always central to what we do, and it's the most important person as we think about that. But we also treat the whole person. We focus on maximizing their rights within society and availing themselves of that, but also treating individuals with dignity, including the dignity for risk and failure. We don't want to be protective or feel like we are making the decisions, because we also uphold autonomy. We're strengths-based. While disability can seem as kind of a negative experience on paper, we're really focusing on what the person can do and how to maximize that potential. We focus on empowering the person to be able to go out and advocate for themselves, but we also do a lot of work on behalf or with the folks that we serve. We are very well trained, and we also follow a code of ethics that's important to us. And we're also extremely collaborative. We don't feel like we have ownership over, really anything. And we also want to incorporate who's most important to the client you're serving. So that really takes it full circle around that holism, but also being individualized and client-centered. So all of this is really rooted in our desire to change and address ableism, which is discrimination against people with disabilities, or the feeling that those who are able-bodied should be preferred, the oppression and the inequity that folks with disabilities experience. So we want to kind of keep that at the forefront. You're trained in kind of two different ways. We are a CACREP-accredited program, which is kind of the gold standard in counseling or ed. And we focus that you're trained as counselors first. All CACREP specialties, whether it be mental health counseling, school counseling, marriage and family counseling, career counseling, they all have a core set of skills. And you'll see that on the left side with general counseling. So ethical practice, theoretical practice and interventions, group and family techniques, as well as individual, crisis and trauma, research. As much as some people are against that idea, we do use research so much because we want to make sure that there's value and validity in what we're doing. Assessment and understanding, using that as the basis for all the treatment planning we're doing for our folks, understanding that there's therapeutic value in work. So career counseling is a crux of actually all counseling. And then cultural humility and diversity, because we do work in a pluralistic society with folks from all walks of life and backgrounds, and also understanding not just race or gender or any individual identity, but the intersection of those identities. But then on the right-hand side, we look at then how we specialize as rehabilitation counselors. So we do have foundations in both the medical and psychosocial aspects of disability, and how those two things kind of interact, how the person experiences and responds to their disability, how their family responds to that disability. How do we create resources and partnerships on behalf of our clients? Case management, because everything from intake all the way to job placement or achieving a goal like graduation and follow through, we have to make sure that we're getting the best folks around the table to cooperate and help that person meet their goals. Healthcare and disability management. So yes, we understand we have to work with health systems and that the medical model has its place, but how do we also try to be proactive, prevent disability, but then also accommodate disability when we look at where you live, love, work, and learn. And then demand side employer engagement, the idea that we want to be able to find out what employers want and then be able to match that to who we have in terms of our clients. Something that's very important to us is this concept of professional dispositions. Okay, so this is going to be foundational values and behaviors and viewpoints that we kind of feel like you should have some basis in if you're coming into a counseling profession. We're going to teach you the skills, we're going to teach you the knowledge, but we really want to have a mindset that translates into effective practice. So we've been doing work as our faculty and very rooted in our codes of ethics. We feel that the 5 professional dispositions on the left-hand side are important to us. So cultural humility, honoring diversity, respecting people that we work with, remaining open to ideas and learning and change and growth, having self-awareness. With self-management, this is kind of all the, can you deliver? You know, time management, organization, being open to receiving feedback and integrating that. How do you set goals for yourself? How do you problem solve yourself? So that's going to be very important in your professional career. Wellness orientation, investing in self-care, being aware of your own personal and physical health and wellness, because it's kind of that analogy of, you know, putting your own oxygen mask on in a plane before you can help someone else. It's kind of the same way. If we're impaired as counselors, then that's something that will not be able to promote the best outcomes for our students. So we want to have our students show some resilience in that area. Professionalism, committing to our counselor identity, that's an important piece. Engaging in advocacy and collaboration, and just how you present yourself, you know, in a professional way. And then lastly, integrity, having responsibility, accountability, maturity, and following through, you know, so those are important. And then basically, if you have that foundation, that's going to translate into the skills that you need for effective practice, the communication, the working with others, problem solving, critical thinking, case conceptualization. So we like to see that strong foundation for folks coming in. Now, my next slide is kind of my favorite thing, because this is really where people ask all the time, well, what can I do? What can I do in this field? And I love it because I'm going to tell you what you can do in the field, but 10, 20, 40 years from now, it's just going to keep changing and evolving. Like, I get so excited when grads of mine from 5, 10, God, now 15 years ago, come back and are like, oh, I'm doing this thing now. And I'm like, wow, like when I got out of school, that wasn't even available. You know, so there's really a lot of opportunities, new populations, new systems that we can be working in. So the practice settings, everything from larger kind of like state and federal systems to private nonprofit, private for-profit. You know, some folks may say that, oh, I want to work, you know, in kind of like a specific setting, going into court and, you know, advocating for folks, working in a higher education setting, or working in a clinic setting. But you can also, instead of just setting, you can say, hey, there's a specific disability group that I want to work with. So there may be, again, you may want to specialize in psychiatric or substance use, or maybe autism. Maybe you have the skills in ASL and you want to work with deaf population or deaf blind population. You know, we have a lot of resources on Long Island and a lot of agencies with great relationships, so we can kind of facilitate some of these experiences while you're in the program. You can also, as a counselor, say, hey, you know what? Even though counseling is this like kind of broad-based thing, I can kind of take one of those things and really make it my own. I did this in my professional career, as well as being a rehabilitation counselor. I'm also what's called a vocational evaluator. So I do assessment and evaluation. And so I do that for people across all different settings, all different age groups, and across all disabilities, but I do the same one thing. Okay, so you can do that. Some people do placement. Some people are assistive technology specialists, so they come up with accommodations and technology to help folks, you know, in their environments that they want to be in. You can also, which is something I also did in my life, specialize by age group. There's a huge need for folks who want to work with transition age youth. As rehab counselors, we don't typically work with like little kids often. If you do choose to be a clinical rehab counselor, you know, there is some place for that. But oftentimes we're working probably as young as like 12, 13. But that transition age youth, how do you get from high school to college? How do you get from high school into your adult roles? How do you get from college to your adult roles, and all kind of places in between? And then lastly, there's just things I probably can't even tell you that are true. Transition specialists, life care planning for individuals who have experienced like catastrophic injury. How do they plan for their future, for the next 20, 30, 40, 50 years, so that there's specialty and things like that. Disability services on college campuses, benefits counseling through Social Security. But we also see from the pandemic, we have needs for rehab counselors in emergency response teams. And how are we dealing with, how our local and communities and municipalities, how do they respond to including people with disabilities? It was, hopefully we've learned some things. It was a sad and hard lesson to learn, but things like press briefings at the White House, not having ASL interpretation, or, not having plain language information so folks with cognitive disabilities could understand, like, where do you go to get a vaccine? Where do you go to get the services you need? So there's a lot of things that really came out of COVID-19 that I think are going to create new opportunities for rehab counselors. So that was kind of the bullet. So what is rehab counseling? Now that you know all that, I can kind of let you in on a couple of secrets. We are one of the fastest growing specialties. We're expected to have at least a 10% growth in the next 10 years. What's good is that if you think about also being a clinical rehab counselor, which will also have mental health licensure incorporated within it, then you can take the growth of both of those industries. We are one of the highest paid counseling specialties. And a lot of this comes from the fact that many of our folks actually work in federal and government systems. And so there can be opportunity for higher salaries within that. But obviously you have to think about geography and where you're, kind of where you're going to end up. We have been a federally supported training program since 1954. So the Rehab Services Administration, every 5 or so years, well, actually every year, but you get a 5-year grant. And we have one right now that I think our current one is a $1 million grant, and about 60% of that goes straight to student tuition. So obviously there's eligibility criteria, and it's not like a full ride, but we're able to offset some of the cost. And all you do is pay back in time. So you don't have to pay back the money. You just go and work in approved settings when you graduate. And for every year that you were funded, you give back in time 2 years. I got both my master's and my doctorate, through some of these programs as well. So they're a great program. And the idea is that it's creative and dynamic. I tell my students all the time, if you like autonomy, if you like change, if you like problem solving, this field's for you, because guess what? It's going to be different every day. Okay, I can't say every day is sunshine and roses, because no job is, but I think that there is so much to offer in the field of rehab counseling that would make it a great career choice. So like I said, we're the only counseling specialty that has the knowledge base to serve all people with disabilities. And I think that that's important. And I really just think it's an amazing career. Some folks say they want to go on and get their PhD. And I always ask the question, why? Okay, because there's nothing wrong with a PhD. I got one, I highly recommend it. But it really depends on what you want. Some folks are like, oh, I want to get my PhD so that I can go on and be a counselor. I'm like, guess what? You can do that with your master's, and it costs a lot less money and takes a lot less time. So if you go, say, the clinical rehabilitation counseling route, you'll be a licensed professional as well as a nationally certified counselor. And you don't need more than that. Okay. If you find yourself saying, I one day want to be a professor, or I would like to be a researcher, or maybe I want to get some really intense specialty knowledge about something, then the PhD does make sense. But don't feel that you need the PhD to be able to do the work. A rehab counseling degree, mental health counseling degree, those are terminal degrees, and they will allow you to be a practicing counselor, okay, for much less time and much less money, okay? So we do have the 2 programs, as I mentioned. We are now, both of our programs are Masters of Science, so they're MS programs. They're both 60 credit, are going to take the same amount of time, little bit of difference though. So both programs make you eligible. When I say eligible, like you still have to take a test and pass it. So you're prepared to become a nationally certified rehabilitation counselor. And the very cool thing about that is that most students take their exam in their final semester. If they pass it, usually when they pass it. As soon as they graduate, present their transcript to the certification body, they are a CRC. They have that credential, which is very marketable, as well as you can get up and graduate from New York and move to North Carolina the next day, and you are a CRC, no matter where you go. Okay, so it doesn't have to be state specific. So that's important to have in hand. With the MS in Rehabilitation Counseling, it also allows you to have a little bit more latitude to kind of choose flexibly where you want to do your field work. When you're in the clinical rehab counseling program, which is our rehab and mental health program, obviously your field work and experiences have to be in approved mental health or substance use settings, because that also has the licensure piece in there. So you have to qualify everything for the state of New York as well. We have some focus within our rehabilitation counseling track in transition, okay, because we know it's such a burgeoning population group for us. We have some courses already built in that focus on that, but we recently just changed our curriculum a little bit in both programs to add some more flexibility. So we used to have our internships were 6 credits each, and you had to do 2 of them. We didn't change our internships, but they're now 3 credits. So that gave us back 6 credits. So now every student is going to be taking their theory class. Then there's going to be a practice skills class before you get into your field work. So it allows you some time to really kind of incubate those skills before you're actually in front of real clients. Okay, so we added the skills-based class, and we also added an elective to each of the programs. So in the rehab counseling program, you have 2 electives that you can take. In the rehab counseling and mental health, which is the clinical rehab program, you have 1 elective. The difference with the clinical rehab program is that there's a couple of classes that are going to be more focused toward psychopathology, consultation in the field, that is specific to mental health populations. For licensure is not something you do in your program. You graduate, you go on your merry way. Then it's up to you to be able to apply for your limited permit, take an additional exam, and then do hours post-graduation. Okay, so 3,000 hours post-graduation before you can have your license. So that process itself takes 2 to 3 years at least. So what is good is that coming out as a clinical rehab counselor, while you're out there trying to get your limited permit hours, just like every other mental health counseling student that's out there, you also already have in hand your national certification as a rehab counselor. So you have a leg up and, you know, that holistic focus within your practice. Okay, so those are the 2 master's programs. I'm not sure who on here qualifies for either of these, but if you are an undergrad at Hofstra, we do have accelerated programs. So if you are in sociology, criminology, community health, or psychology, you can apply for the master's program in your junior year, and then in your senior year, you can take up to 15 credits of coursework that will count both for your undergrad and your master's program. So it's a nice option, and it is incorporated into your undergraduate tuition. However, if you are someone who is just applying from another university, you have to have your undergraduate degree with at least 3 core prerequisite classes. Now, we're very flexible in terms of that. We want to see some psychology, sociology, disability, mental health, some of the criminology courses, public health types of courses, anything around disability to really, you know, flavor your experience and make sure that you understand, you know, what draws you to this field. We prefer a GPA of 3.0. Obviously, if you don't meet that, that doesn't necessarily exclude you, but that's something important. And then if you have done any graduate coursework that's relevant, we potentially can transfer up to 12 credits of that. Okay, if you got another degree at Hofstra, we can actually transfer more. Okay, at the graduate level. But if like you took research as an undergrad, we can't transfer that in and give you graduate credit for it. It has to be graduate level courses. And if anyone on here is already has a master's degree, if you have a master's degree in a related field, we have a program for you to obtain your CRC. Okay, if you have a rehabilitation counseling degree from another university, you can come back and add on the licensed mental health counseling. So if anyone is in that situation, please reach out to me and I can give you a lot more information about that. But typically we do individualized plans of study for that. You know, if you're coming to get the CRC, actually the credentialing board will review your transcript and say, here's the areas you need, and then we'll build a plan of study based on that. When it comes to rehab counseling, mental health, if you have a prior rehabilitation counseling master's degree and it was very recent, then likely you'll only have to take 2, 3, 4 classes. But if it was a longer time since your degree, you, since curriculums have changed, you may have to add more classes for that. So kind of coming to a close, you know, what's great about our program is that we are situated with mental health counseling, school counseling, creative art therapy, and marriage and family therapy, along with our 2 rehabilitation counseling programs. Some classes may also have maybe higher ed students or sports science students in them. So we're a very interdisciplinary department to begin with, and you can be kind of co-taught by other specialty faculty. So that's a good thing and a good perspective. This degree will also lead you toward other paths, like my credential as a CVE, a certified voc evaluator. With a CRC, you can vie for that. Our program provides most of the education if you want to pursue the CACREP, which is the addictions counseling. We have opportunities for student engagement through our honor society for folks who have a 3.5 GPA or higher while they're in their master's program. It's an international one. And we also have a student counseling association. We do a lot of work throughout the year with student events. Last year, our entire program and focus was on Black Lives Matter and how to incorporate that into counseling. And then this year we've been working on professional response through advocacy. So really good programming there. We have personalized advisement. If you come into our program, you're assigned to either myself or my partner, Dr. Midas. So, but you can obviously talk to any of our faculty, but we also try to create mentorship opportunities and experiences based on what your goals are. We do not throw folks to the wolves and say, go find an internship. We have a placement coordinator, and we make sure that we do that based on your interest, geography, setting, population that you want to work with. And then in the students who are preparing for the national certification exam, we actually have an online test prep program that we use to help students prepare for that. So, and that's kind of an ever-growing thing. So if you're interested in applying, it seems like a long list, but it actually doesn't take that much to get together. So you have to obviously do the graduate application online, transcripts from all your undergrad and graduate institutions, writing a personal statement, but it's fairly specific what we want. So I have a guidance document that will help you craft that. 3 letters of recommendation. Unless you've been out of education for a long time, we would like one of those, at least one, to be academic. And I have a guidance statement for that so that it'll help them guide their letter for what we're looking at. An updated resume. Once all of that's in and I've reviewed it and you seem like a good candidate for the program, I would invite you for a personal interview. Prior to the interview, I would send you, we have a self-assessment on professional dispositions just to kind of get you thinking about, you know, ahead of the interview, because our interviews are based on the professional dispositions and being able to gauge that. And then after that, we just give you a short case scenario, and because we want to see just your thought process. Obviously, you might not have the skills and knowledge base currently to be a counselor, but we want to see just kind of how you'd be able to think that through. So all in total, I would say the application, depending on how quickly your letters of recommendation come back, typically once you gather all the information and your application is given to me, there's usually about a turnaround time of about 2 weeks where, you know, if you're going to be invited for an interview and moving through that process. So we don't have necessarily like a date and then like everyone interviews at the same time, at least not for rehab counseling. So we do rolling admissions, but ideally, especially if you want the grant funding, we would, if you're interested in the fall, by May or June, we would like those folks in because you have higher priority to be able to get the funding. And yeah, so that's not too difficult of a process, but if you need more help in deciding, you can always consult with one of our faculty. They can talk you through, you know, the financial options, career guidance, and what a plan of study might look like for you and how it would fit in. We do cater to working folks because all of our classes are in the evening, okay? You can, if you're interested, you can speak to one of our program alumni, either from the rehab program or the clinical rehab program. especially folks that might match your interests for what you're looking to do professionally. Or you can speak to one of our current students and just kind of understand that experience, and what that's, what that's been like for them, and get it, from their point of view, what the program is really like. Okay. So if you want more information from me, I mean, I'm gonna stop the slides in a second, and see if there's any questions, but if you have any questions, or you want to submit an application, reach out to me, because then I can give you those guidance documents for the recommendations and for the personal statement, and it'll just kind of have you in a much better place to be able to facilitate that application process. Okay.